Madam Chairperson and members of the House Judiciary Committee, thank you for your endurance and the opportunity to testify. My name is John DeLuca. I'm a Providence resident, and my work is social services. The debate concerning same-sex marriage in our state has heard philosophical, theological, and sociological arguments. Both sides express their views, leaving some margin of interpretation. There is, however, one approach that clearly points to solid, concrete, empirical data that should point out the dangers to the health of our society if we promote the homosexual lifestyle. The argument against same-sex marriage from a health point of view is solid. Our own Rhode Island Department of Health did a study in 2006 on HIV/AIDS and indicated 78% of the HIV cases reported to that date were male subjects. Of the males infected, 75% declared to be actively engaged in homosexual activity. Some of the remaining 25% of the males could have been engaged in homosexual activity, but did not declare it. Others contracted the disease from heterosexual activity and using dirty needles in injecting themselves with drugs. Homosexual activity was by and large the source of males contracting the HIV virus. Now again, in 2011, our own Rhode Island State Department of Health did a similar study and found the following. A total of 3,131 cases of AIDS has been diagnosed in Rhode Island as of 12/31/11, since they started keeping statistics in '93. From the beginning of the epidemic through 2011, 1,523 deaths from AIDS occurred. In 2011, there were 2,014 persons living with AIDS in the state of Rhode Island. In 2011, that year alone, 83 men and 14 women had positive HIV tests. The evidence is in. It's clear that homosexual activity is the greatest breeding ground and source of HIV/AIDS. The mission of the Rhode Island Department of Health is to protect and promote the public health. The Rhode Island legislature is responsible
your
body.
Last sentence now.
Okay. Who should be supporting its own Department of Health. Passage of same-sex marriage can be perceived by young and naive as an endorsement of lifestyle that could lead to experimentation and thereby exposing participants to life-threatening and debilitating diseases. Thank you.
Thank you, sir.